Hey guys, it's Melanie, the educator, and I just wanted to take a few minutes to talk to you guys about chest tubes. There's been some issues TriStar wide with some chest tubes. So chest tubes are something that we don't do very often, and so nobody's ever really confident about chest tubes, but they're really not that hard. One of the other things that we recently changed in the supply room is we had these long thoracic catheters in this white package. And these should be gone. Now you shouldn't see them anymore. They are out of the supply room, but you never know when things might make it back in. So on this side is the fenestrated side. This is the side that goes in the patient. And this side is the side that gets hooked up to suction. And in this particular tube, this end is too small to be hooked up to suction. So the problem is that people were having trouble hooking this up to suction because it's not the right size. So this tube should not be in supply anymore. You should not see it. What we do have are these long white tubes that are trocard tubes. So they come out with a large metal stick inside this tube. Now these are trocars. Metal trocars are not supposed to be used anymore, but what you can do is as you open that tube, just remove the trocar and hand the tube itself to the doctor. Keep this end of the tube sterile because that's the side that's going to go in the patient. And this end is the side that goes to suction. There are two sizes in our chest tube box, 28 and a 32 French. Now the chest tube box is a plastic container that's going to go in room 7. It is clear sides with a blue lid, and I'll send you guys a picture. Now that box has everything you need to start a chest tube. So if a doctor says, I need to start a chest tube, you need to go get the box first. There's a pneumothorax kit in there that has everything the doctor needs to insert a pigtail catheter or one of those real tiny tubes that goes in the upper part of the chest. That kit is in there, and there's also these larger tubes, and these are usually placed mid-axillary line and 5th intercostal space. So they're the lower end tubes. They're bigger. They're meant for people who are having liquid, usually blood, drainage. So when you go to set up this box, which can be used with either kind of tube, so you can use it with these large ones or you can use it with the little pigtails. Most of the time the pigtail tubes, or you just use the flutter valve or the Heimlich valve, and it comes in the kit with the pneumothorax tray. So if you're going to set up the atrium box, it comes in a big blue square container, and it is inside the chest tube box. Open up the paper, you kick out this base just to give it some structure so that you can do what you need to do. There's only one hole on the top. That one hole on the top is where everything happens. So on the back side of this, there's a pre-filled tube with water. You just untwist the top, you place it in the hole, you fill it completely full of water. Now it will fill this chamber up here at the bottom, the water will turn blue, and you will have a water seal. Now this is also where you connect your suction. So when you're ready to connect suction, you need to connect it here. It will not suck the water out, but that is where the suction is connected. The last thing is to take out this tubing from the back side of the atrium and hand this end to the doctor. And keep this end clean because this is the side that's going to go to your tube. It comes with a 5-way connector. If you drop it or you need another one for some reason, didn't come with one, there is another one inside the chest tube box. Once you hook up to the patient, then you need to hook up suction to the wall. Suction to the wall should be 80 millimeters of mercury or better. Now, if you go too high, I should say, there is no too high. So as long as you have this bellow and this letter E, this orange like little accordion piece will come across this window. And if it is out, then you have enough suction. If it looks like this, you do not have enough suction. If you ever need to adjust your how much pressure you have on your tube, there's a little wheel right here that you can turn. This is very uncommon. They come out set at -20, and that's appropriate for almost everyone. Okay, so just quick tips for managing a chest tube. When you're transporting a patient, you can remove them from suction, and they're still on a water seal with this box, so they don't have to be hooked up to suction. You can also transport patients on a Heimlich valve, which is the piece that comes with the pneumothorax tray. And never, ever, ever clamp a tube. The only reason to clamp a chest tube is because you put it in the lung on accident, and that's a surgical emergency. You do clamp that tube, and what you will see is your patient will get very, very, very sick very, very fast. So the two I've seen in my career were not questionable. They were very, very fast. Their vital signs changed dramatically. They were not able to breathe. So that tube gets clamped, and then the fix for that is another chest tube, and then they have to go to surgery to repair the hole in the lung. So that's a big deal, and thankfully it's very rare. But that would be the case when you would clamp the tube, and that's the only case. Small bubbles are normal. You should get a lot of bubbles in the beginning because all that air is being released. Little tiny bubbles here and there is okay. That's that air coming out. A continuous bubbling is indicative of a leak. So trace your box all the way back to from your patient all the way to your box. Make sure you don't have any loose connections or any problems there. And then always keep the drain lower than the level of the tube. So in the top here we have these hangers that are conveniently made for hanging on the side of the stretcher, just kind of like a Foley catheter, and they will hang low to the patient as well. All right, so I hope this has helped a little bit, and I hope the new box is wonderful. Remember, the new box is in room 7, and if you guys have feedback about the box, let me know, because we can change the contents or add or take away or do whatever we need to do. So thanks for watching.